and get started, but I do want to welcome everybody to the second installment of Oral Wellness Matters with Open Care. This is our Instagram live series where you get a chance to ask questions with experts in the dental space. And today we are really, really lucky to be joined by Dr. Jeanie Luong, who is one of the top dentists on our platform. So hi, Dr. Jeanie. Thank you so much for being here.
Absolutely.
Somebody else knows you down there. Hi, Dr. Luong. Wonderful. So, and for those of you who don't know, my name is Charlotte. I work for Open Care. So Open Care is a platform that connects people with the top 10 to 15% of dentists in their city. And, you know, really the mission that we're on is to empower people to take proactive care of their oral wellness and, you know, make the process of finding and booking time with a quality vetted dentist as easy and as convenient as possible. And so in this Instagram live series and just generally, you know, our goal is to keep you happy and healthy. And, you know, I understand that there's a lot of uncertainty right now around COVID-19 in the world and then also in dentistry. And we're trying to figure out what its impact is and is going to be. And so, you know, whether you are a patient or you're an office manager or, you know, you are a dental practitioner, we want to be able to provide you with the resources and all the guides that you need to help you through this time and understand how to manage the dental experience in this climate. So yeah, as I mentioned, we're very, very lucky to be joined by Dr. Jeanie Luong. She is a dentist here in Toronto who is incredibly accomplished. She obtained her degree from the University of Toronto and in 2010, and then since then has actually continued to stay on the forefront of dentistry. She's gained skills in digital dentistry, implant placement and restoration, advanced oral rehabilitation. So, and we definitely know on the Open Care platform that our patients love Dr. Luong so much. So again, thank you so much for being here. Why don't you tell us a little bit more about Baywell Dental, your practice, and a little bit more about your background?
Yeah, for sure. So thanks for having me on Instagram live here today with Open Care. I'm super excited to be here. So a little bit about myself. I'm Toronto born and raised. I did my training at U of T, like you said, and I went on to associate all over the GTA for a few years until I started my own practice right downtown at Baywell. So our practice philosophy at Baywell is to empower patients to make great decisions about their oral health. I love dentistry. I'm super passionate about providing excellent, efficient, personalized care. I do a ton of continuing education so I can be the best dentist possible for my patients. I'm always looking to incorporate new technology into my skill set. So for example, we like to use computer-aided design and milling. It's known as CAD/CAM, so we can 3D print big fillings that fit better and perform longer. In our office, we started with a small team. So we've been through several transitions, including renovations and building a brand new sterilization area last year. We've grown an incredible team who's equally passionate about dentistry and patient care as I am. In my personal life, I recently became a new mom to a 9-month-old baby boy, Logan. He's awesome. And I started to go back to work after 4 months when COVID hit. So I, like many others, are trying to navigate this scary time as a new patient and business owner. But I love my career and I love motherhood. So it's all about finding that perfect balance in family and career goals. Yeah. It's challenging, but you know, it's very rewarding.
That's awesome. That's really great. No, we're super happy to be with you here today. And, you know, it's, I know that our patients really appreciate the level of care that you provide for them. So this is awesome. I'd love to jump into the questions. So today's theme is dentistry in the wake of COVID. So what does it look like reopening, getting back to the dentist? What does that look like for practices, for patients? And what does the future look like going forward? So, you know, in the audience, you guys can add any of the questions that you might have in the comment section below, and we'll be answering as many as we can over the next half hour or so. So feel free to ask any questions that you have regarding COVID-19, oral health, or dentistry, or anything else as it relates to those subjects. So actually, to get us started, I have a question that I would love to know is, obviously dental practices can't be running and 100% open right now. So what have you been doing to run your practice while things are shut down?
For sure. So on March 15th, our regulatory body issued a statement strongly recommended that all non-essential and routine services cease immediately. So only emergency treatment should continue, and only if you had the proper PPE, so N95 masks, gowns. We made the decision to close our office because of the shortage, and during that time, they were being directed to medical facilities where they were most needed. But I knew that there would be many patients stranded without care, so I decided to take my expertise online. So myself and another dentist at our office, Dr. Jeanie Luong, we've been offering free consultations to help triage patient care. So first, we identify if you have a bona fide emergency and then where you should go. So for example, if you needed an emergency surgical extraction, I have a colleague who's an amazing surgeon, Dr. Daniel Fortino. He works in hospitals and private practice, and he has access to proper fitted N95 masks. He's made it really easy because I can contact his admin, Bella, and she would reach out to you to coordinate. Or if I think that you might need a root canal, I'll prescribe antibiotics and I'll send you to my favorite root canal specialist at endodontic specialists. Or maybe you just have a broken retainer wire and it's cutting into your tongue. So Dr. Cormier discovered that dental emergency services at St. Clair, they can remove broken wires that are causing pain. So it's our way of providing personalized care during this time. I've seen so much kindness and generosity in the community, so we wanted to do this free of charge to help people.
That's amazing. I love that. I think, that's one of the silver linings that comes out of a situation like this is people and communities really band together, and it's great to see that you're helping people prioritize their health. So I love that. We actually have a really great question from Damien, which has also kind of been on my mind, which is, should we be scared to go back to the dentist once practices open up?
Mm-hmm. That's a great question, and that's a resounding, you should not be afraid of the dentist.
Okay.
Of course, you should be vigilant anytime you go into a public space and be mindful of your surroundings. But dental offices are extremely safe because of our rigorous infection control protocol already. So you'll be hard-pressed to find any space more thoroughly cleaned and disinfected in the public arena. For example, in our office, we have an infection control officer whose job is just to make sure everyone's doing the proper protocol. Furthermore, dental problems don't go away, and teeth require maintenance to be healthy. They just do. So an analogy I would use is your car. Imagine you skipped 3 oil changes in a row. You're going to have very serious consequences if you ignore your teeth. Now, we may not be considered essential right now during a pandemic, but dental care is absolutely essential for your oral and overall health. So I encourage you to communicate with your dental providers. When you go back, you might wonder what measures are being put in place for your safety. So just ask questions and engage. We're experts in infection control. We've been doing this for a long time, and we're happy to share our knowledge.
Awesome. Okay, that's good. That puts me at ease because I was wondering. I was like, maybe I'll just never go back, but I mean, last thing you say to a dentist, Charlotte. Awesome. Okay, cool. We have lots of really great questions coming in. So this one's from the audience. What precautions should I be taking coming into the dentist, and what should I be looking for in terms of it being a safe space for me to come to a dentist? Is there maybe like a checklist or some red flags that we should be looking for?
Yeah, for sure. So that's a great question. So just to start off the answer, Dentists Ontario already follow a strict infection control protocol. It's outlined by a committee called PIDAC, the Provincial Infectious Diseases Advisory Committee, and they advise Public Health Ontario on matters related to patient safety and infection control, among other things. So they already provide a best practices document that ensures patient safety. So our staff get rigorous training because the procedures are really thorough and have extremely high standards. So one example that patients might care about is like the autoclave of sterilization of instruments. So we bag and sterilize dental kits. They are treated at 120 degrees Celsius, and it's under steam pressure for a prolonged duration of time. So this inactivates bacteria and viruses, including the one that causes COVID-19. So these bags are marked, time-stamped, and recorded so that we can have quality control, and they're not opened until you walk in the room. So this is like something we already do. But there are going to be additional measures in place to further reduce patient exposure. Before I say that, though, I want to say that our regulatory body, they're currently working towards an evidence-based guideline to help protect the public and dental workers upon reopening. So there's no official guideline yet. But there are some things that many of us in the profession believe will be in place. So some examples are increased administrative controls. So that's the first step in reducing transmission. That's policies, procedures, education, and training of our staff. These are things like increased screening and temperature taking. The next thing you can expect is engineering controls. So these are things that are going to be put in place to reduce exposure to the virus. So things like plexiglass barriers, perhaps operative rooms might be sealed with plastic doors. There's going to be spaced out appointment times, and you might expect at your dental cleaning that the hygienist will only do hand scaling. So that's a tool that's normally you get Cavitron, right? And it vibrates to break off tartar. We might not be doing that for a little while.
Oh, wow. Okay.
Yeah. The last thing they're still going to do a very thorough job though.
Yeah.
They're just going to be working even harder.
Okay.
And the last thing you can expect too is increased PPE. So PPE is the last control mechanism to protect workers and patients. That's face shields, gowns, and maybe those N95 masks that I mentioned. They have a superior seal compared to the surgical masks, but we don't know 100% that the virus is transmitted via aerosols yet, so we're still studying that. Basically, you can trust that we're going to do everything we can to keep patients and staff safe while still delivering much needed and necessary dental care.
That's awesome. Okay, that's good. You got it under control. No problem.
Yes,
you're
totally. On it.
That's so great. We have an awesome question from Carrie as well. So they want to know, do you have any recommendations for what we can do at home other than brushing and flossing to take care of our oral health while we maybe can't go to the dentist?
Yeah, so that's a common question I've been getting from patients through online inquiries too. And my message actually remains the same during COVID and non-COVID. The first thing is good plaque control. That's key. So plaque is a biofilm made of food and bacteria. The longer it sits in your mouth, the more likely it's going to cause cavities and gum disease. So that means brush, floss, use mouth rinse, whatever you can do to get it off. The second thing is moderate consumption of acidic beverages. So if you drink things with high acid content, like sports drinks, pop, beer, wine, things that we are definitely consuming a lot of these days, you're going to over time eroding your teeth. So it's important to just limit it or at least drink it quickly as opposed to sipping on it over hours.
Okay. All right.
One more thing.
So I will be using a straw for my glass tonight, Friday night.
I love straws. Paper straws.
Metal straw, not plastic.
That's good too.
That's awesome.
Another thing you can do is avoid hard foods, especially if you have big fillings. Stay away from crusty breads, hard nuts, chewing on ice, things like that. If you grind your teeth, wear your night guard. If you don't have a night guard, find ways to de-stress. It's so stressful for everyone right now. So carve out some time for relaxing, yoga, meditation, jaw massages, and take some breaks from reading COVID news.
That's amazing. Yeah. I think that's so important to remember is that like it's so important to think about your overall wellness routine, right? It's not just limited to your oral care and like brushing and flossing, like taking care of your oral care should be a part of your overall routine. So I think those are really, really great tips. Thank you. And we also have a question from Mitra, which I think might actually be perhaps a practitioner on our live today. They want to know, do you have any advice for dentists reopening?
Mm-hmm. So as a profession, I think we need to do our part to communicate with patients and earn their trust. We have to educate and inform patients that we're going to be responsible stewards of their safety. So I believe that's going to have a huge impact on getting things as close to normal as possible. Another great resource that I'm using, if you haven't already, dentists and staff members, it's called the Dental Community Resource. So they release weekly webinars keeping us abreast of emerging information about COVID as it relates to dentistry. So for example, they released a webinar interviewing dentists yesterday in different areas of the world who have either reopened or stayed open during the crisis, from Singapore, Italy, the US. And for me, as a practitioner, it was really interesting to see what's happening in dentistry worldwide. In these times of uncertainty, I can only focus on what I have control over, which is staying calm, evaluating information critically, and being available to my patients any way I can. So I encourage dentists to keep in touch with your patients and your team members. I think patients want to hear from you, whether it's an email to update them, like when we're going to be open or what we're going to be doing to keep things safe, or a phone call about the state of their upcoming appointments. We've tried to be available to our patients, and I think they really appreciate that.
Yeah, I bet they do. That's great. Wonderful. We also have a question from Sarah. Do you think that your patients are going to have to wear PPE when coming into your clinic?
So as I said, there's no official guideline yet, but I think that patients are going to be given masks to wear immediately when they walk in and offered hand sanitizer. And then additionally, on top of that, before they start their appointment, they're going to be using a mouth rinse, most likely hydrogen peroxide. It's actually been demonstrated in studies that will reduce the viral load. So that's great. So that you might be expecting.
Amazing. Okay. Keep everybody safe. That's good. Cool. And Alana wants to know, how do we know if dental offices are truly ready to take in patients?
What do you mean by that?
I'm wondering if perhaps if there's like an official body or like an official sort of guideline and checklist maybe that you know.
Sure. So we are going to get guidance from our regulatory body, the RCDSO, and they're going to let us know when it's safe to reopen. There's no official date yet. They're still working on it. There are some places in Canada that have reopened already. So BC and Saskatchewan are starting to reopen. So we're waiting to hear from our body to know.
Okay. And so I imagine, Elena had a follow-up question. Is there going to be a checklist? Do you expect that something like that is going to be a part of what they release?
For sure. Absolutely. That's what we're all waiting for. There's going to be an official guideline on best practices on how to practice post-COVID. And you can be assured that dentists take infection control very seriously, and we all want to keep patients and staff safe. So we're going to be following that protocol. I can't wait to receive it.
Yeah. We're all patiently waiting.
Yeah.
That's great. And then we have another really great question here. So do you think that patient volume is going to increase quickly when things open back up, or do you think it's going to take a while to get back to normal?
So that's a really tough question. I think the answer is both. I think there's going to be a backlog in patient needs because dental care has been suspended for 2 months. There's going to be patients who want to come in and have their needs addressed. But on the flip side, there's going to be patients who are fearful and uncertain. Some patients might rather stay away and then ignore their dental issue because they feel like it's unsafe to come in. So this is where we, as a profession, we need to do our part. We have to reach out. We have to let patients know that we are putting measures in place that will ensure their safety. And if they know that, and they know that we're at the helm controlling this, then hopefully they'll feel safer. Yeah.
Absolutely. And so, Alex asks as a follow-up here, if I'm a new patient, how quickly would I be able to get an appointment when you reopen?
Yeah, so normally once we reopen, we're going to send out an email. We're going to post it on our website. And once we know, if you call in, we'll book you the soonest appointment available. Most offices are open Monday to Friday, sometimes on weekends. So ASAP, basically.
Yeah. Okay. Oh, well, that's good. All right. So I think we have time for a couple more questions here. Something that I would actually like to know is, what do you think that the dental experience is going to look like in the post-COVID-19 world? What lessons do you think that we're going to learn from this, and what do you think is really going to stick and actually change the way that we do dentistry moving forward?
I think that there are going to be, every time something like this happens, there's going to be a overhaul in our policies and procedures. We're going to be examining what we do already, and we're going to figure out what's working and what's not. So in dentistry, like I said, infection control is already so important. So we're going to be following a lot of the same rules. There are going to be minor changes for sure, like some of the things I had mentioned earlier. But only time will tell. We'll have to see what's going to happen. It's really tough. A lot of us don't know.
Yeah. And you know what? We're all in the same boat, right? Like every person, every industry, it's a constantly unfolding situation. And I think we just have to lean into the discomfort of the unknown sometimes, right? Like we're all in this boat, but I find solace in that a little bit, that we're all in this together too. So
that's a great way to put it.
Yeah. And then, so finally, I think we'll go for the last question here. Mohammed says, can you see certain procedures being prioritized over others when you reopen? Like, what's the approach going to be to, prioritizing different types of appointments, and then, new patients versus displaced patients? What is that going to look like?
So for sure, we're still in the midst of the pandemic. It's not over yet. So I expect that the initial phases is going to be prioritizing urgent or emergency care. So that's the screening part. So when you call in to find out if you get an appointment, we're going to try to figure out what your dental issue is. If it's important, like a broken tooth, cavity, things like that, we'll have you in as soon as possible. But if it's more for like cosmetic procedures, bleaching or whitening, that might wait for a while. Yeah.
Okay. All right. Well, that sounds good. I don't think I've ever been more excited to go back to the dentist in my entire life.
I never before, do dentistry in my life.
That's amazing. Well, okay. Thank you so much. I really appreciate all of the incredible information, and thank you so much for all the work that you're doing to get us through this and help people take care.
We have a visitor.
Hi.
Logan.
Hi, Logan. Wait, hold on.
Just came in to say hello.
Y'all, I think this might be Logan's first ever Instagram live. This is amazing.
It is.
Hi, buddy. How are you? Oh, this is so lovely. Oh, I'm so glad you got to join us at the last minute. Look at all the hard eyes. Everybody's going crazy for Logan. So cute. Well, thank you so much for taking the time, and wanted to thank everybody in the audience as well for your questions and your participation. So much good information. Again, Dr. Luong, thank you for your guidance. Thank you to your team for all the work that you all do. And, definitely check out Baywell Dental at Bay and Wellesley. You can find them on Open Care. If you have any questions that we didn't get a chance to fit in today, please do feel free to reach out to us. I know that Dr. Luong is on Instagram. You can reach out to Open Care, and you can also visit opencare.com/COVID for more information and resources there. We've put together a hub to give you everything that you need. But that's everything for today. Thank you so much, everybody, for joining, and Thank you again, Dr. Long. Thank you, Logan. And we'll see y'all next time. Thank you so much.
Okay, thanks.
Bye.